Are you a weekend warrior? Do you feel the aches and pains after a weekend of tennis or biking? Knee injuries are a common problem, and this afternoon, Dr. Alan Saperstein of Boca Raton Regional Hospital joins us to answer your questions. Nice to have you with us today.
Nice to be here.
Do you in fact see more knee problems in older people, or are you seeing in younger people who are very athletic, or is it both?
It actually is both. The population has become more active in recent years, particularly here in South Florida. And of course, the population is aging, which makes them more susceptible to orthopedic injuries.
I understand that one of the most common knee injuries is one associated with the ACL. Why is that?
Well, the ACL is the anterior cruciate ligament, and as the name would imply, it's a ligament, a piece of tissue that connects two bones together and gives stability to joints. The ACL lives in a little narrow notch between two bones in the center of the knee, and when one twists or turns to the side, the ligament can be stretched over the bony walls of that notch and may make it susceptible to rupture.
So if you have an ACL injury, does that mean surgery is imminent?
Well, it depends on the individual. The ACL gives stability to the knee, and so once it's torn, the knee becomes a trick knee, one that tends to buckle. If one plans to engage in sports with twisting, turning, and jumping, like basketball, football, soccer, you really do need an ACL, so surgery is required in those individuals.
So what other injuries, though, would an athlete have to be conscious of involving the knee besides the ACL problem?
Well, one very common injury is meniscus injury. The menisci are two little cartilage spacers between the bones. They act as shock absorbers. And as one ages, they tend to wear out a little bit, and they can tear very easily. When they tear, they cause pain. And typically, they're treated with minor arthroscopic surgery, and that can correct the problem quickly and with a very short recovery.
What types of sports? We always hear about knee injuries and, he blew out his knee on the football field. But what other sports are susceptible to knee injuries?
Well, typically sports that involve twisting, turning, side-to-side motion. So soccer is very infamous for causing knee injuries. Basketball, volleyball, tennis. But even sports that have straight-ahead motion, like jogging, can cause wearing out of tissues, can cause tendinitis or stress fractures.
Okay, Dr. Saperstein, you play a game of volleyball, you have a great match, you play all morning long, your knees hurt, or you feel like they're really, really sore. When do you know you need medical attention? When do you know it's going to feel better the next day?
Well, that can be a tough question to answer. Typically, there are a few cues. If you see swelling in the knee, that's usually a sign that there's a problem. If you have symptoms like buckling or locking in the knee, that's a problem. And of course, if you have pain that's not going away after a short duration, or if it's severe, that's another indication that you need to see an orthopedic surgeon.
Can you fully recover from a knee injury?
In most cases, yes. Most of the things we talked about are fully correctable, either surgically or non-operatively. There are occasions where there can be damage to a knee that's not repairable, typically when the damage is to the joint surface that can lead to arthritis.
What about those knee braces?
Well, prophylactic knee bracing to protect against injury is very controversial. Traditionally, there's been no proof that that really prevents ligament injuries, but there is some evidence coming up that perhaps it may prevent a minor knee injury called an MCL sprain.
Oh, okay.
So there may be some benefit to it.
Thank you, Dr. Saperstein, for your time this afternoon. Boca Raton Regional Hospital sponsors our doctor and also underwrites our Ask the Doctor segment. We're back with more in just a moment.